benefits will be starting January 1st until December 31st of the next year. So here on our introduction page, very important, we have the open enrollment dates. So these are the dates where you will be able to select your benefits. Open enrollment started on December 2nd, and you have until December 10th to make all of your choices. After December 10th, the platform will close and you will no longer be able to make any choices or changes. Also here on this page, we have a description on who is eligible to enroll in benefits. So any full-time employees working a minimum of 30 hours per week are eligible. You may also want to include dependents on your plans. So this could be someone like your legal spouse, domestic partner, any natural or adopted children as well can be considered dependents. Also very important on this page, we have a description of qualifying life events. Normally, when you choose these benefits, they are set in place for the entire year and you cannot make any changes. But in some cases, you may experience something called a change in status, where you might want or need to make some changes on your coverage. So this could be things like if you get married, if you get divorced, or maybe you adopt a child, or you or your spouse give birth and you want to add your children to your plans. These cannot qualify as a change in status. So if one of these things happens to you, you have 30 days to notify your HR representative to make those appropriate changes. Also, to make these changes and these selections, we're going to be using Employee Navigator. Most of you are probably familiar with this platform, but it's very likely that throughout the year you forgot your password, and absolutely no worries. We have instructions here on this page on how to reset your password, as well as how to register as a new user for any new employees or anyone new to this system. Very important. This company identifier here, Caliber Sales, is case sensitive. So be sure to pay attention to that when you're using it. Also, the Employee Navigator system is very user-friendly, very intuitive, and you can even enroll in all of your benefits on your phone by scanning the QR code at the bottom of the page. So here we just have some general terms that are important to know when discussing benefits. Not everybody is very well versed in all the terms or knows the ins and outs, but here's just a very basic overview of some things that are important to keep in mind during the presentation as well as throughout the plan year. So here we have the medical insurance page. Your benefits are going to be offered by Florida Blue. You have two plan options. One is going to be a Florida only option with only in-network benefits. And then option two, you're going to have a national network with both in and out of network benefits. We always recommend to stay within the network. It's always going to be a lot more cost effective, but the option is available to you if you choose medical plan 2. So going over a little more about option 1, once again, it is a Florida only plan. So if you live outside of the state of Florida, you are not eligible for this plan. The calendar year deductible of this plan is $4,250 with a family deductible of $8,500. After you meet your deductible, Florida Blue will cover 100% of the cost of those specific services. You also have a calendar year out-of-pocket maximum of $9,200, and for families, it's going to be $18,400. So this is going to be your maximum exposure on this plan. Once you meet that dollar amount, Florida Blue will begin to cover 100% of all services. So it's just a way to give you that security, knowing that you're never going to have to spend more than that maximum. Also, with both of these plans, virtual care is going to be $0 with Teladoc, and any diagnostic labs are $0 with Quest Diagnostics. I heard from a Florida Blue representative a few meetings back that Quest is best, so that's a good way to remember that whenever you want to get labs done, that Quest is the way to go. Also with option 1, any primary care physician's visits are going to be $35 and $65 if you would like to see a specialist. Also, under this option 1 plan, you do need to select a primary care physician, but you do not need a referral to go see any specialists. Starting in urgent care all the way down to complex diagnostic imaging, all the way down to diagnostic imaging, you're going to see this little asterisk star next to all of these services. That means that it is also applicable for coverage through the GAP plan, which we will discuss a little bit later, but I wanted to point it out while we're here. Also, down to prescription drugs, it's going to be a copayment structure. So tier 1 is going to be a $15 copay. Tier 2 is going to be a $75 copay. Tier 3 is $150, and any specialty medications are going to be $300. You also have mail order pharmacy available to you at a 90-day supply, and that's going to be 2 times retail copay. So going over a little bit about option 2, like I said, this is a national network plan with in and out of network benefits. But I'm just going to discuss a bit of the in-network benefits, but out of network is available to you. So your calendar year deductible under option 2 is going to be $4,250. And for families, it's going to be $8,500, as well as the same coinsurance at $100. Your calendar year out-of-pocket maximum is going to be the same as option 1 at $9,200 and $18,400 for families. The biggest difference with these plans, as you can see, the majority of it is exactly the same. It's really that network flexibility is going to be the biggest difference, as well as what state you live in. Also, all of the costs for prescription drugs are the same as well, but very important, out-of-network medications are not covered on this plan. Also, we have some additional information on lab services through Quest Diagnostics down below. Always remember, Quest is best with Florida Blue. So like I had mentioned, we have the GAP plan available here. We have one option available to you. And with this GAP plan, you do have to meet a deductible before you start to receive the benefits of this plan. But the deductible for the GAP insurance is much lower than your medical plan. So you would still be receiving a great amount of extra coverage through your GAP. So for anybody not familiar with GAP, I think of it like multiple buckets of money that you can use for different services. If for any reason you have an inpatient hospital stay, any inpatient procedures, anything inpatient within a hospital, you have $5,000 per covered person that you can use towards those costs. So it's a great way to help on that medical cost exposure. You also have a second category of $5,000 for any outpatient procedures. So this could be things like radiation therapy or chemotherapy, as well as outpatient surgery or diagnostic imaging, CT scans, PET scans, things like that. You also have some additional benefits if you need to see a physical therapist or a chiropractor. So you have $1,000 to use towards that specialist cost, as well as an ambulance benefit, which is going to be $2,000. So if for any reason you need to get into an ambulance to go to the hospital, you have $2,000 to help with the cost of that ambulance ride. Here we just have some additional information on utilizing your gap insurance. Very important whenever you receive any service to have your Transamerica card as well as your Florida Blue card. And if wherever you're receiving the service, they have any issues submitting the claim, or if you want to submit the claim on your own behalf, we have instructions on how to do that here. And if you have any issues with your claims down the line, we have a contact page at the end of this presentation where you can reach out to anyone on the Brown & Brown team and we'll be able to assist you with your GAP claims. So here we have some information on some of the benefits through Florida Blue. So I had mentioned that Florida Blue virtual care through Teladoc is $0. So it's a really great free and accessible benefit to receive medical care anywhere in the country quickly and easily. So if one day you wake up and you have a cold or you're not feeling too great and you don't want to leave your house, or maybe you don't have an appointment anywhere, you don't want to wait in a waiting room, Teladoc is a really great option to use for that. You can register through the Teladoc website as well as the Teladoc app on your phone. And you can visit anytime, 365 days a year, 24 hours a day. And if the physician needs to prescribe any medication, they will prescribe it to your nearest local pharmacy. We also have this benefit for Florida residents only. So, Sanitas Medical Center is kind of a one-stop shop for a lot of medical services at low cost or completely free to you. On the next page, we have a map with all of these South Florida locations, but you can get $0 copay doctor visits. You can receive preventative care. You can get $0 urgent care services, which is a really great benefit, as well as labs and diagnostics all under one building. Now, not every Sanitas Medical Center has the exact same services, so feel free to review this map to see what is the best location for you for the services that you might need. Also, for anybody on the national plan or seeking service outside of the state of Florida, we have some additional instructions here on how to find a provider. We also have a brand new benefit for everyone called a flexible spending account. So, a flexible spending account is a really great way to set aside pre tax dollars to save money and to put aside money for medical expenses. You can use it for a very long list of things. There's a list here on a lot of the different things you can use your FSA for, but the list is even longer than this. So, it's a really great benefit to save. Most people save an average of 30% on taxes through this account. And the 2025 FSA contribution limits are $3,000 and $3,300. There we go. So really great benefit to sign up for to start saving money today. Here we just have some additional instructions on the EBC mobile app. So how you can manage and look at the information having to do with your FSA account. Here we have a page going over the importance of preventative care. It's very important to get your routine labs, your routine checkups done to make sure that everything is okay and in order. And also, it's much easier to treat things the earlier that you catch them, and also much lower in cost to treat any conditions the earlier that you find them. Hopefully, you never do, but it's always good to stay on top of it. And we also have a website resource here, health.gov/myhealthfinder, where you can put in your age and your sex, and it will tell you what preventative care you are potentially qualified for. So it's a great resource to stay informed and to stay up to date. We also have this page going over the importance of being a smart and informed consumer. So we have a couple of tips on being a better consumer for you to review, as well as some information on pharmacy discount programs that you can utilize completely for free. A really great and popular one is GoodRx. So all you have to do is download the GoodRx app and look up coupons for your prescription drugs. It's not connected at all to your medical insurance, but it's a really great way to potentially save some more on your drug costs. Here we have dental insurance offered through Humana. This is going to be a DHMO plan. With a DHMO plan, you only have in-network benefits, so very important to always check that your preferred dentist is within the Humana network. And like all the other pages, we have the instructions on the page here. You do not have to meet any deductible, and you do not have to have any kind of waiting period in order to start using these benefits. Also, this plan is going to be a co-payment structure. So based off of whatever diagnostic code your dentist gives you, that is going to determine the cost of services. Also on this plan, very important, you have orthodontic services available for both adults and children. You also have a PPO dental option available to you for those who want a little more flexibility with their network. With this plan, you have in and out of network benefits available to you, but like everything else, we always recommend to stay within the network. With this plan, you have a calendar year deductible of $50 and a family deductible of $150. And a great benefit with this plan is you do not have an annual plan maximum, so you are never going to max out of your coverage on this plan. But with this plan, you do not have orthodontic services available, so that is important to keep in mind when choosing which dental plan you'd like to move forward with. We also have vision insurance offered through Humana. So once again, you have in and out of network services available. We always recommend to stay within the network. So they're offered through Humana, and it's a great way to get some additional help with the cost of things like frames and glasses, and a great way to save on your routine care. So there's some supplemental worksite products available through Colonial, and I'm going to pass it over to Alex to start going over some of the information on these Colonial products. There's a couple of slides here for me to go through, but I will hand it over to you, Alex.
Thanks, Gabby. Good morning, everybody. Thank you so much for joining us. I appreciate your time today. Um, as Gabby and Laura mentioned, you guys have some wonderful benefits which have not changed from previous, so that's always a great thing. Big kudos to the team for really working through and making sure you guys are covered. These supplemental plans are in addition to the core insurances. So even if you're not on the medical or not on the dental or vision, these are completely separate from that. These plans, you can add your spouse or your children, even if they're covered under different plans. So it really allows some flexibility so that if you want to be on the medical, but you want to add your family to the accident insurance, you're allowed to do that. Each of the plans have a separate price point, which will be in Navigator for you once you sign up. So that will be listed once you're going through the enrollment process. The top plan is something called the accident insurance. It's exactly how it sounds. It pays for accidents both on and off the job, not just car accident specific, but if you are, playing outside with your kids and something happens, or if your children play sports and they have to go to the ER due to an injury, it's going to cover the actual services that they receive, whether it's an emergency room, a doctor's visit, physical therapy, and then the actual injury itself you'll receive a benefit for as well. So it covers fractures, dislocations, and then again, the services that coincide with those injuries. The great thing is that it is worldwide. So if you're traveling and something does occur, you just bring back a bill from a service that you got done, and they will reimburse you for that injury specifically. The way this works is that a little different than your gap insurance. This will actually pay you money directly and in turn use it to pay your bills. So if something happens with your child and you have to go to the ER, you take them to the ER, you present your medical insurance, and then once you get that bill from the ER, you can submit that to Colonial and they reimburse you directly. Right below that is something called critical illness insurance. Think of this like a living life insurance benefit. So you choose an amount from $5,000 up to $30,000 on a guaranteed issue basis. If something were to occur and you were to have any of these illnesses listed out on here, it would pay you for that diagnosis. If something happens and you do pass away, that would in turn go to your beneficiary. So if I have a $10,000 benefit and I have a heart attack, then it's going to pay me the $10,000. If I were to pass away from that heart attack, that would in turn go to my beneficiary. Both the accident and the critical illness insurance have something called a wellness benefit. So once a year when you do your annual exam with the doctor, we pay you for that. These are some of those, major things such as colonoscopies, mammograms, those kind of areas, cholesterol tests. So not really something for your children as much, but if you're doing a well-known exam, or for the gentleman, if you're doing, blood tests for triglycerides or anything like that, this will actually pay you directly for those wellness exams. So keep in mind, if you have our plans from last year and you did a wellness exam, there is a way to file. If you call the 1-800 number, or if you log on to your Colonial Life portal, you can just simply put in your doctor's name and phone number and they will submit the claim directly to you. Thanks, Gabby. If you don't mind, go to the next slide. Appreciate it. Whoa, too quick there. Thank you. So the next plans that we have is something called cancer insurance. The reason that this is separate from the critical illness is that this goes really above and beyond just a diagnosis of cancer. So if someone's diagnosed with cancer, they will receive a lump sum payment from $5,000 to $10,000. And then depending on the services they have, it pays additional money for chemo, radiation, experimental treatment, transportation, lodging, the whole 9 yards. So it really goes above and beyond your traditional medical as far as covering you for things that aren't normally covered by your medical insurance. So again, these are benefits to help offset the cost, or in the event that there's experimental treatment that may not be covered by medical, we're going to give you a benefit for that. But again, it's there to help offset those costs due to cancer treatment as you go through that journey of cancer. If you don't mind, Gabby, next slide. Thanks. The next plan that we have is something called our individual disability insurance. This is short-term disability, meaning that if you aren't able to work after a certain time period that you get to choose, this will pay you a benefit directly up to $4,000 per month. So the waiting period is the very first day after an accident and a week after a sickness, and it will cover you up to 3 or 6 months. You get to choose the benefit duration, and this covers up to 60% of your salary to a maximum of $4,000. The beauty of this is that, again, this is covering your income while you're, sitting at home waiting to recover. So God forbid if I had a car accident or something and I was out a month, this will cover me for that entire month. If I were to have a sickness and I'm out a month due to the flu, the first week isn't covered, but the next 3 weeks I would receive that benefit directly to me. Okay. For ladies, this does cover pregnancy. There is a 9-month waiting period on pregnancy. So basically, you cannot be pregnant when you sign up, but after January 1st, then it would be eligible for covering you for pregnancy. And it does have a 12-month pre-existing condition clause for any other illnesses. So if I'm diabetic and I get treated for diabetes, it's not going to cover something directly correlated to diabetes for the first 12 months. Everything else it would, because it's guaranteed issue, but that specific illness it wouldn't cover for the first 12 months. And then this also has a $50 wellness benefit that you can tap into as well. So once you do your annual exam, you can also claim on that. Thanks, Gabby. The final product we have is something called term life insurance. Again, this is a great way to protect your family. God forbid something were to happen. This covers you for 10, 20, or 30 years. And the way it works is that you choose an amount from 10,000 up to 5 times your earnings, and it would cover you if something were to happen and you were to pass away. The great thing is that you are locked into that rate. It's very economical, and you can choose a beneficiary of your choosing for that matter, and you'll have that coverage for that time period. Let's say I chose a 20-year term. If I, knock on wood, I outlived that 20-year term, then it does renew at a higher rate because obviously I'll be 20 years older, but you do have a guaranteed renewability, which is great as well. There's also spouse and child term options available, and as well as an AD&D rider that you can tap into as well. Thanks so much, Gabby. Thank you, everybody, for your time. To sign up for these, you would go onto your Employee Navigator portal. As you're going through your regular benefits, these will also be those options on there. We also provided a link. If you had questions, a rep can walk you through not only the colonial portion, but the medical, dental, and everything else that you have on there. Thanks so much, everybody. Appreciate it.
Thank you, Alex. So here we have the employee deductions. So this is a chart going over what the cost of each product will be, as well as what it would look like if you choose for yourself and your spouse, or yourself and your family. These are going to be bi-weekly deductions, and they are also pre-tax deductions. So this gets taken out of your paycheck before taxes are applied. And for any colonial life and supplemental plans, those calculations will be available on Employee Navigator. And also, like Alex said, you can go through that whole process with a colonial enroller. So there's a lot of information that we've gone through today in this presentation, and it's very important to keep hold of this contacts page. Here we have your human resources representative, as well as your dedicated Brown and Brown team. Anybody on this team can help you with any issues that you have throughout your year. If you have any issues with your medical plan, with gap, dental, vision, all of the above, you can reach out to any member here listed on the contacts page, and they will be able to help you. You have Laura, your account executive, who's here on the call with us today, as well as all of the carriers listed here on the contacts page if you would like to reach out to any of them directly. Lastly, we have the Benefit Hub. So Benefit Hub is a great discount marketplace that you can utilize for a very long list of discounts. So a lot of different travel discounts, hotels, car rentals, Disney tickets, almost anything that you can think of is here on Benefit Hub. And all you need to do is click on this hyperlink here, and you sign up with your email, and you'll be ready to start looking at all the different discounts. So thank you so much to everybody for listening to this presentation, and we will now be opening it up for questions. So feel free to unmute yourself.